Hey everybody, what's going on? Welcome. Today I'm here, Justin Vizakis, with my wonderful assistant Kim Estes, IFBB Pro Bikini. The piriformis muscle. This is probably one of the most neglected and misunderstood muscles in the entire body. Now it's located right down here. You have all your lateral rotators, okay? The biggest one here in the middle is your piriformis. The functioning of the piriformis goes like this. Goes out to the side and to the back. There you go. Good job. Now, what a lot of people don't realize is that when they're doing squats or training legs, especially women that want to build their glutes and train them like 3 times a week, okay, you can't squeeze your glutes all the time because you're essentially squeezing the muscles underneath the glutes constantly. And when you do that, you end up locking the muscles in a short position. Okay, and especially when you're doing squats, okay, if you're constantly going wide, notice there's a little bit of a dip in her hips right there, okay? That, come up again slowly. All right, come back down again slowly. Right about there. How her hips kind of dip down like that, okay? Right. There are 2 other muscles that work synergistically with the piriformis to create this nasty spiraling effect of rotation of the hips, so they kind of go back. Okay, if you turn to the side again for me. If you look at Kim, she has an amazing body, obviously. Now look at, I'll bring her up for a little bit. Okay, if you look at her hips, okay, they're slightly rotated back. Okay, now this is going to be, she's a bikini pro, so when she poses, and this is especially true for bikini competitors, okay, when they pose, they have to stick their ass out, all right? When they stick their ass out, they're essentially tightening up that piriformis, but also, more importantly, tightening up the psoas muscle, which I'll get into in another video when I specifically talk about the psoas, okay? And when that happens, you're essentially crunching the lumbar spine and tightening up both those muscles to almost act like a python, okay? It's locking it right up. So, how do we prevent this, and how do we fix this? If you're an athlete and you're, say you're doing squats or any kind of leg movement, all right, you wanna not go so wide stance anymore, okay? Because that's incredibly detrimental. One way that you can actually tell if you've gotten to the point where your piriformis is locked short is this little test right here. Okay, I want you to stand to the side.
Facing you or not?
So that the hips are facing this way. There we go. Okay. You're gonna put your feet shoulder width apart. Okay, and then slowly you're gonna go ahead and and do a squat. So I want you to do a proper squat with your feet just like that. Okay. Now, yeah, come back up. All right. I want you to go much slower. Okay. Now stop. Now at the point where the upper body has to come forward, okay, and the hips start to dip, okay, that's the point where the piriformis is holding this in place where it can't expand the entire way that it's supposed to. Okay, come back up. Okay, so the upper body should be able to essentially stay straight up and down. The spine should be able to stay straight and erect. Okay. A healthy piriformis should allow you to go all the way up and all the way down with perfect form. Okay, so go ahead. Here, I want you to put your arms like this, straight. Okay, so we want this to stay perfectly even. Okay, we want the upper body to stay perfectly straight up and down. Okay, with the spine in alignment as she comes down, without leaning forward. So go ahead, come down slow. Okay, stop. Okay, I want you to slow it way down. Okay, go ahead, come down again. So right about there is where her upper body is coming forward. Therefore, her piriformis' range of motion stops right about here. Okay, so that's a little less than 50%. Okay, they come back up. So you want to practice doing your squats with your feet at shoulder width. Okay, and when you get to that point, you need to be very self-aware in order to be able to identify this. Okay, when you get to that point where your body goes out of alignment, you want to kind of sit in it. Okay, and allow your hips to kind of relax almost. You're going to shift the weight onto your quads. okay? And then you're gonna come back up, then you're gonna really focus and go slowly and control it, okay? And get back down into it again, like so, okay? Bring your arms back up. I want you to go slowly, and I want you to feel when your body comes forward, okay? Right about there. Okay, now I want you to pay attention to the feeling in here. Relax this, squeeze your quads, and just let it sit in there and attempt to sink down into it. Okay, keeping your body straight. Do you feel that? Okay, go back up. Okay, it takes a lot of effort. However, I'm telling you, it's worth it, and your body will thank you for it. Go ahead and bring. Oh yeah, go ahead, you do it. You tell me what you're doing. Okay, so here, her leg is at a 90-degree angle across. Okay, she's pulling her other leg toward her, so that this is getting stretched. Also, this is too, and her hips. You want your tailbone to be touching the ground. Very, very important. Okay, you don't want your hips to roll up. I mean, like roll them up real quick. Here we go. When they here we go. Beautiful. When they roll up, that's no bueno. Okay, so you want to have those down because that's keeping your spine in alignment. Also, you want your shoulders to be back as close to the ground as possible. Okay, so that's going to keep your entire spine flat in alignment while opening this up and giving that nice good stretch. You want to do that on both sides. Pull it for a minimum of 30 seconds. It's really tight. I would even say up to 2 minutes. Okay, so then there you go. Good job. I'm proud of you. Okay, she's kind of sore today, so I'm trying to be nice. I don't want to make her do too much work. You guys get the idea, right? Okay, so also, let me show you guys a little technique here. It's pretty simple. This is a massage technique, okay? Anybody can really do it though, as long as you understand your anatomy, the basics of the anatomy. So go ahead and flip over. Okay, so your lateral rotators basically start here and go all the way over here, okay? Especially if you're posing a lot, getting ready for a show, this is priceless because this is going to cause you a lot of problems. Okay? You're going to bring this leg up. Okay? You want to be sitting on the other side, so it's right in front of you, however, for the sake so that you can see it. I'm going to be over here. Okay? You can take your knuckles or your elbow or your fist, whatever you're comfortable with. Okay? Right about here in the middle, you'll be able to feel it. It's going to be like a little lump. Okay? You feel that little lump. Okay? Right to the point where it's semi-uncomfortable, but not excruciatingly painful. Okay? You want to do what I call the windshield wiper method. Okay? You're going to come out slowly, and you're pressing at about a 45-degree angle in. Okay? See how I'm not even pressing hard, and she's already feeling it. Okay? Now this is stretching out everything in the hip. And I'm sure you can't see it, but it's even twitching down here a little bit too. This is also a primary cause of sciatic pain as well. About 95% of cases that think that they have sciatica, it's not sciatica, it's piriformis syndrome. And it's this tight muscle and it's easily fixable. Okay, so don't just suffer for no reason. Okay, I'm gonna bring it to the inside, nice and slow. I'm gonna have them nice and relaxed, okay? Because the only way it's gonna open up is if their muscles are relaxed. If they're contracting it, no good. Okay, bring it this way. I'm sure you can see the twitching a little bit because she's really tight. All right. However, with her relaxing, it's allowing it to open up. Okay. You want to go real slow at first and just help it unwind. Okay. That twitching is because there's already some compression going on in the muscles because of the inflammation deep in there. Okay. So the twitching is actually a good thing because as you do this, it causes a sort of a pumping action. With it gets blood in there and it opens up the area so that the nerves have no problem firing. Okay? So, very slowly, if this is your first time, definitely go light and get used to the feeling. You don't want to bruise them and you don't want to hurt them. Okay? Nice. Now, ultimately you want to press in starting at the middle here, right above the greater trochanter of the femur. Okay, in this little meaty area right here. You want to press in there and then come up all the way around, okay? So over here, I'm going to come in, back and forth a few times, as far as it's comfortable. and just ensure that they're nice and relaxed. That's not getting overwhelmed with pain. This should not be that painful. Okay? I promise you, go ahead and give this a try the next time that you're doing squats or legs, period, like before you actually start training legs, and you will notice you are way more powerful and you get a lot more out of it. All right, so thank you very much for tuning in. I'll be back next time with talking about the psoas muscle. All right.